The number of people dying from heroin overdoses in New York has doubled in the past 5 years. We have been reporting on the epidemic for months now, and something we've heard consistently is that getting treatment covered by insurance is a very difficult process. Jennifer Lukey spoke with a local family that knows firsthand just how devastating a denial can be.
He was very athletic. He grew up in Maine and just outdoors all the time.
Bob Wasson Sr was a father himself when he got hooked on heroin.
I sat him down with my wife and I told him, you keep this up, it's a death sentence, because that's the only way it ends that I know of.
Bob Jr. overdosed 3 times.
He kept telling me, he says, I can't be a good dad, because I don't want to be around my kids in case.
Bob says his son tried to get inpatient treatment on a number of occasions, but ran into roadblocks with his insurance coverage.
After one overdose, he was admitted to someplace down in Kingston, and his insurance even said then, they sent him a notice after that they didn't approve it. And it was like a 4-day stay, which is nothing for a heroin user.
What did insurance offer?
Outpatient treatment for a heroin user. That's absurd.
On a Tuesday afternoon, Bob Jr.'s girlfriend and children found him dead on the kitchen floor. He was 33 years old.
If a doctor who's had years and years of training states that there should be that certain treatment, who are insurance companies to re-diagnose? Doesn't make sense to me.
The evidence shows that for most cases of heroin addiction, the best course of treatment is on an outpatient basis, not an inpatient basis.
Paul Masalik runs the New York State Health Plan Association, which represents insurance companies. He says over the last few years, insurers have expanded coverage, but the focus has to be on what's proven to work.
As many as 25 to 30% of people have had 5 or more admissions already for heroin addiction and treatment. So for those people, you really need to start looking at different treatment modalities.
More specifically, the need for medication in overcoming addiction.
For a lot of people, a lot of families, when you say methadone, that comes with a stigma, and people don't want to have their child maybe become a methadone user. And yet the evidence would say that they have a better success rate.
Shouldn't it be the doctors and the providers who are working directly with those people who decide what the best course of action and treatment is for them?
Well, that's a mixed bag. And that's why there's an appeals process that exists in terms of insurance coverage for the recommended treatment.
Bob's son, though, he never got a chance at an appeal.
I try to think of his children, the good things he left behind.
That was Jennifer Lukey reporting. Last week, New York lawmakers did introduce a package of bills intended to combat this heroin problem, including one that would require health insurance providers to cover rehab programs and anti-addiction